Good.
Do you have the questions?
How you doing?
Thank you for your time.
Yeah, no problem. What do we have here?
Alright, so I want to start.
Yeah.
Alright, so can you just introduce yourself, your background?
Yeah, who are you guys?
Oh.
I'm Akash.
Mitchell Page, Jason.
Weston.
Talia.
Ashley, I'm hiding.
Very good. And what class is this for?
An entrepreneurship class.
And you guys are all sophomores?
I'm a junior.
I'm a junior.
Sophomore.
Junior.
So mostly juniors, okay.
Yeah.
So my name is Mit Desai, or Dr. Desai. I'm a general surgeon that graduated from Wayne State in 1997. Went to University of Illinois for my residency, and then started a solo practice in Naples, Florida in 2003. The following year, moved to Tampa, basically did the same thing, started a solo practice, and then probably a couple of years after that, I noticed that there's, a need for surgeons to do a lot of ER work and emergent and urgent surgery, and so I started a company called the Surgicalist Group, and it's a different name back then, but now it's called the Surgicalist Group. Anyways, what we do is basically we go into a hospital and take most of the ER call there and operate on emergent and urgent patients, basically. So, that idea kind of really took off back in 2009 because we went from having one or two hospitals to having about 6 hospitals within a period of 18 months or so. And now we're actually in Tampa, Phoenix, and Orlando. And we just got a private equity group to inject some money into our company to try to expand it and grow it a little bit faster and across the country a little bit more. So in a nutshell, that's kind of what I do and who I am.
That's awesome.
Yeah. Alright, so the motivation is probably done.
Yeah.
So what challenges did you face to become an entrepreneur?
Yeah, the challenges are, not everyone knows about the idea of a surgicalist. So, like you guys may not know what a surgicalist is, and similarly, even people in medicine really don't know what a surgicalist is because it's not a very old concept, it's a very new concept. People have heard of a hospitalist, which is an internal medicine doc that basically goes to a hospital and doesn't have an outpatient office, but they haven't really heard of it for a surgeon or a general surgeon doing that. So I think the biggest obstacle is trying to get people to understand what we do and, make them understand that we're not people that just come in, operate, and then leave. We actually take care of our patients even post-operatively. So we have follow-up in our office in a couple of weeks or whatever it may be. We don't abandon our patients. But I think the biggest obstacle is letting people know about what we do.
All right. You guys want to take one question?
Sure.
So what lessons did you learn from your experience?
Yeah, there's always lessons to learn, and I guess I'll take one of the most recent ones is that a lot of times we don't necessarily provide the best customer service as far as the whole billing process goes. So people love us as far as the surgery goes, and they do well, and they have great outcomes, and they have no complaints as far as the surgeons go and the actual outcome of the surgery, but they have complaints about the whole business of surgery, I guess, so the business of how they can navigate through their insurance and make sure we get paid appropriately in that whole process. So because of that, one of the things that we're going to implement is kind of a full-time dedicated customer service rep to help us with that. But there's always lessons you're learning in business. I mean, you can't be stagnant for very long.
All right.
What recommendations? Sorry, I'm over here. What recommendations would you have for us as future entrepreneurs, hopefully?
Recommendations, I guess there's so many. I guess the biggest one is that it's it's not easy getting out and doing what you love and doing what you like and having it succeed. But I guess a recommendation would be to really focus on what you love doing and then figure out a way to make money off of doing that. And if you do that, I think you'll be successful no matter what it is that you end up doing or you end up picking.
That's really good advice. What skills do you think are most important to develop if we want to be successful?
You got to know your numbers. You got to be analytical, know your numbers, and you got to know your data. That's the biggest thing in business these days, big data. You got to know exactly what you're doing, what your outcomes are. Whether it's surgery or whether it's a small business, whether it's a mom and pop convenience store, you got to know exactly what's coming in, what's going out, and you got to have a good idea and a good process in place to control those factors.
All right.
You good? You got the last one?
Oh, I'm good. Thinking good. Can you define like entrepreneurial success? Like, what would you call? Like in class, we learned how there's a difference between a small business owner and an entrepreneur, and so basically the difference is the growth. Small business is just like my mom, just one store, and probably you as entrepreneur just grow your business out. So what do you see yourself as?
Yeah, so it's a good question. So probably until about 2 years ago, I saw myself as just probably a small business owner. We were only in Tampa at the time, and I think we provided, we're a service provider basically, right? So we're a general surgeon providing a good service. To take that to the next level where you're engaging in multiple markets in multiple states across different geographic areas, different demographic areas, I think that's what makes you an entrepreneur. And it doesn't matter what you're doing, once again, whether you own a small business like a convenience store or whether you're a general surgeon. The biggest thing is scalability. Once you figure out scalability, I think that's what transforms you from a small business owner into an entrepreneur.
I think that's all my questions.
Yeah, I think that's all.
Awesome.
All right.
Thanks again for your time.
Yeah, I really appreciate it.
Good luck, guys.
Thank you.
Thank you.